This session is on communication in eye care, and I welcome each one of you to this session. I hope you stay with us for the next 1.5 hours for a wonderful brainstorming on why we should pay so much importance on communication, the art of communication, the why, how, and what of it. And we have some wonderful speakers with us today, whom I'll introduce when the time comes. And we have even more wonderful expert panel with us. Dr. Ilan himself and Dr. Anurag from Orissa is a part of our expert panel. So I hope that all of you stay with us, and please do put your questions in the chat, and we will have a lot of fun. Be rest assured. So without wasting any more time, let me share my screen and start the first talk today. A very good afternoon to each one of you. I thank Karnataka Ophthalmic Society Scientific Committee and Dr. Ilan Kumran in particular for giving me and my team this opportunity to present this course of communication in ophthalmic practice. I'm very happy to share that this is the third time we are getting invited this year to present the same course. The first was at All India Ophthalmic Society meeting, second in Gujarat Ophthalmic Society meeting, and then in our very own Karnataka Ophthalmic Society meeting. So we will be talking about, I will be talking about the what, why, and how of communication skills. Dr. Soumya Basant will talk about role of empathy in communication, especially empathy, the training of empathy for optometrists and ophthalmologists. Dr. Katyani will be talking about enhanced communication in challenging situation in eye care hospital. Dr. Nazia will be talking about documentation of critical communication. Yes, if you are planning for NABH accreditation or already implementing NABH standards, this will be very important for you because communication is a standard in itself in NABH. The discussions which we'll have in the panel discussion is how to build patient loyalty through better communication. What are the tips for effective communication? What is an innovation in communication which each one of us can do? And how does a leader help set the culture for better communication in hospitals? So let me start by my topic, effective communication in eye care, why, how, and what. A brief introduction about my own self. I run Zaminda Microsurgical Eye Center in Bangalore. We have 3 NABH accredited centers, and I'm very happy today that 3 senior doctors from my organization are also joining the session today. I'm an NABH assessor, the founder member of Women Ophthalmologists Society of India, and I do adoption-related pro bono work. My hobbies are acting, poetry, and visual thinking. And my key to success is if you try, you might. If you don't, you won't. At AIOS 2021, when we started with this journey of creating a communication course, it was very, very well received. And let me start by asking this basic question. Why do we need to worry about effective communication? We need to really worry about effective communication because communication is of different ways. By putting the right signages is also a part of communication. So let me just go through the different parts of communication in an eye care hospital. The first and foremost is visibility of available services. The patient who comes to you should definitely be very sure about what is your scope of services, and that should be very clearly communicated. It should not be that he's waiting for about a few hours and then gets to know that that particular facility is not available in your center. So obviously appropriately place signages and directions, conveniently place help desk, standard operating procedures for clinical, operative, and administrative staff, preferred practice guidelines for uniformity of care, surgical safety guidelines, anesthesia safety guidelines, establishment of defined admission, inpatient care and discharge mechanism, handling medical emergencies, establishment of defined admission and inpatient and discharge mechanism, dispensing of drugs, hospital infection control, biomedical waste management, grievance management, and counseling and informed consent. All this is a part of proper communication. At all these different stations in an eye hospital, communication plays such a vital role. So today we will be talking not in detail about what is there in this, but how a communication should happen at each station and the ethos of communication. I hope that each one of you get this chance to read this book by Malcolm Gladwell, Blink. In this wonderful book, he talks about why certain doctors get sued. He says that when a patient enters your consultation room, it is the first 1 or 2 minutes he decides about whether to trust you or not. Isn't that an interesting phenomenon? So in the first 1 or 2 minutes, if you have goofed up, you have lost this chance of making a bond with your patient. Yes, your eye contact, the way you look at the patient, the way you address your patient, how less distracted you are in this present world where there is a computer in front, there is a phone, there is a mobile phone. So this is very, very important. Your first few minutes with your patient. Let's enjoy this video.
Tomorrow never comes is right, but that there will be a day when there will be a tomorrow that will never come. But between that tomorrow and today, there will be many tomorrows. So when that time comes, when that tomorrow will not come, until then you have a lot to do.
I hope you all enjoyed this video. So I'm sure you understood also what I was trying to say. How easy and simple was that communication? We really cannot fall into this trap. Whatever we say, each word should be very crisp and specific and well thought over. So yes, you would agree with me that there is a paradigm shift in the practice of medicine. Are we God even now? We aren't, unfortunately. So is it enough, our communication at all levels? I want each one of you to just maybe close your eyes and put yourself into the patient's mode in your own hospital. Are you a satisfied patient now? Do you think that you have at each station in your hospital, if you enter as a patient, the communication is perfect? Think about it. Ophthalmic surgery patients are elderly. Communication becomes very, very important. So how do we achieve effective communication? The first and foremost thing is that besides you working on your own communication skills, you need to even see that your staff is also working with the right communication skills. And there is definitely the importance of right attitude towards work and value of patients. Do you or your staff think that work is burden, that patient is a burden? It starts from there. If that is corrected, then subsequent training will work. If that aspect is still not corrected, then whatever communication training you give your staff, I don't think that it will work. So teamwork has to be acknowledged. Your team should be a happy team. And then you can see that any training what you give them will definitely be successful. Is communication as simple as soft skills? Do you think that, especially in an eye care? I'm throwing in this few questions to you because through the next 1.5 hours, we will seek out for answers for these same questions. Communication training is negligible. You would agree with me. When was the last time you conducted a communication training in your hospital? Think about it. Well, this is a picture of a communication training which happened in our hospital. And I'm very happy to share that this gentleman told us that verbal communication is only 30% of your communication. Your tone, tenor of voice, and your body language is 70% important. So how much importance do we really give to that? Believe in the magic of communication. Believe, believe, believe. Does good communication really help? Or it is just a part of your PR mechanism? No, my friends, you will be mistaken. Your diagnostic and treatment accuracy improves if the communication is better with you and your staff. Patient compliance is better and patient safety issues are less. Communication errors are the major cause of 60% of medical errors. 3% of adverse incidents are reported. We all need to have an incident reporting culture in our hospitals. How many hospitals do really have an incident reporting culture? If you do have, you will be surprised that 60% of your medical errors are because of communication errors. The handing over triangle is known as the Bermuda Triangle of healthcare in communication. When a patient has been, patient details are given from one doctor to other or from one staff to another, especially if you have more doctors in one organization, you have to be extremely, extremely careful. And when there are reduced conflicts with staff, patients, and family, with a better communication flow in your hospitals, you yourself as a doctor go home as a happy person. 70% of legal cases, the cause is communication errors. Breach of confidentiality is a major cause of litigation in West. That is improper communication. That is also a part of communication. If you are caught discussing about a patient in front of some other patients, that is definitely improper communication. And this, in Western countries, is a major cause of litigation. So what do you mean by effective communication? When I'm talking about communication, I would like to answer this question straight away right now. Respond and never react. The patient who comes into your room might be very angry. He might have emotional reactions because he has waited for a very long time. Maybe he has some personal issues. So whatever he says, you cannot react. You have to just respond. That is your duty as a wise owner. Involve patients in decision-making. Facilitate decision-making. They will never blame you for it. Give them options, address their concerns, clarify the doubts. At the end of it, they might tell you that, doctor, you do whatever you feel is best, but then you have earned it. And once you have done it in this particular manner, the patient will never blame you for not involving them in the decision-making. Put yourself in their position at every stage, at every minute in your practice when you are in your hospital. Empathy, empathy, and empathy. And your staff needs to follow the same, especially your optometrist team. Same line of communication in case of an adverse event. If something wrong happens to the patient, it can happen definitely, the communication should be in the same line, especially in an adverse event. And there should be a hierarchy for that communication. Everybody is not talking a different story. Then the patient is very confused and the patient does not want to believe any of the stories. So ideal communication is building trust with the patient, being transparent with the patient, accept your own limitations. There is really no harm in saying sorry, and help in informed decision-making. Keep updating the patient at different levels of care. Again, keep talking to them. Remember, we are practicing in a world where the patients are very, very Google savvy. If not the patient, it is their patient's son, grandson, daughter, granddaughter, who would come and tell you 10 different things about the treatment, what you have offered. And control your own emotions. I think we all need to do a lot of meditation, yoga, and then practice. And that's the success. Then that's what we get in communication. Enjoy this little video.
My asthma. They said they'd fix it, but it didn't make any difference at all.
Well, sometimes doctors make mistakes. Anna, you need to try twice as hard to fix them. Are you using your inhaler?
All the time. Go through one a week.
You sure you're using it right?
Do I look like an idiot?
No. Why don't you show me how your inhaler works?
Thank you so much for this opportunity. I can be only as good as my team. So I thank each one of my team to help me and support me. And because of all of you, I'm here today. Thank you so much. Thanks once again to the Karnataka Ophthalmic Society for giving us this chance. So we come to our next speaker, Dr. Soumya Basant. Dr. Soumya Basant is our senior cornea specialist, and Dr. Soumya is going to talk about a very important aspect of communication, that is empathy. Over to you, Dr. Soumya.
Thank you, ma'am. Can you hear me?
Yes, very well.
I'll start sharing my screen. Visible? Is my screen visible?
No, doctor, no.
Is it visible, ma'am?
Yes, very much.
Okay, yeah. Thank you for the introduction, ma'am. It's been a pleasure being associated with Zamandar's Eye Clinic for the past 5 years. Today, treading on the path of communication, I'll be emphasizing the role of empathy. Empathy per se plays a vital role in the society in all interpersonal relationships. Today I'll be dealing with the role of empathy in communication in an ophthalmic setup, including the optometrists, the ophthalmologists, and counselors, and all other people working in your organization. Empathy is a concept which is very ambiguous, difficult to define, and difficult to measure. I'll take you through a few things which will help us, give a suitable definition for empathy and how to measure. There's a psychometric analysis for it, which can be measured in a particular way. This is the whole agenda of my talk. What is empathy? Why do we have to practice empathy? And how do we practice it? Coming to the spectrum of empathy, at the bottommost, we have pity. Climbing up, we have sympathy, empathy, and compassion. Pity is when you pity a person or you feel sorry for that person. Sympathize is you feel sorry, you actually feel whatever the emotion they're going through. Empathy is you feel a different sort of emotion. It's a cognitive entity. Compassion, empathy, a cognitive empathy derives you to act with an altruistic motive. Compassion being the highest in the spectrum. Various psychologists have analyzed and kind of tried and defined various types of empathy. There can be a lot of overlap between the definitions of it. Broadly, they've divided it as emotional, cognitive, and compassionate. Emotional empathy is your ability to understand or feel somebody's situation or predicament. Cognitive empathy is you understand or you experience what they are feeling. Compassionate empathy is when you've understood what their concerns or the suffering they're going through, which drives you to act so that which is beneficial for them as well as the society. It becomes very essential to differentiate between empathy and sympathy because the outcomes of both for the healthcare provider as well as patients are very different. Empathy is a cognitive entity. Cognitive entity, I mean, this thing you have the ability to understand a person's predicament, whereas sympathy is a deep emotion. It's an affective entity. Empathy has an optimal clinical outcome, whereas sympathy has vicarious traumatization, that is a negative feeling towards a traumatic incident. There is a linear personal growth when we practice empathy, whereas in sympathy, there is compassion fatigue. With empathy, you can have an optimal career satisfaction, whereas by sympathizing, you can have a career burnout at a later stage. Empathy can be taught, whereas sympathy is not amenable to great changes. What is empathy? The perspective of empathy is you walk in a person's shoes, a mile in the person's shoes. That is, you understand what they are feeling, what their concerns are, what is their fears, or what is their emotional status. You feel for the person, you feel sorry for the person, you truly understand what they're going through. In any situation, you understand, you relate to what a situation they are in. Why do we lack empathy? If I ask this question, if I want and say a hands up of how many of us practice empathy, I think all of us would say yes, but maybe not at all times. Why do we lack empathy at certain times? Maybe feeling threatened based on our own fears or projections or our past experiences. We are being judgmental, thinking that we are right and the other person is wrong. We have made a statement saying we are right and the other person is wrong, and we are being highly judgmental about it. Then any fear, which is a natural human emotion, it protects us or guards us from various threats and being judgmental. All these things, cause us to lack empathy. Maybe not at all times, maybe at certain times. What are the benefits of empathy? It's bidirectional. When we practice empathy, not only as a healthcare provider, even with our subordinates or a relationship between anybody in the organization, it enhances relationships. It reduces the stress. The work environment will be much better and pleasant. It decreases the negativity in the environment. You build a long-lasting trust between the patients or even your subordinates. You can relate to strangers very easily and you build compassion. Why we should practice empathy? You understand, as a care provider, as a doctor, the onus is on you. You should understand your patient's concerns. You should lend a patient ear to them, listen to them attentively. You understand what is the emotional state they are in. then probably, they would divulge very sensitive information about themselves. Probably there has been a recent divorce, a separation, or a loss of a near and dear one. They might not tell it out to everybody. Probably all of you would have, in your experience, noticed this. Usually when any patient walks in, he's seen by the optometrist, they record the vision, the correction and the glasses and all that. Along with that, they record their systemic conditions, whether they are diabetics in some years or hypertensive or any other systemic issues. I think even in the Indian society, it's still a great taboo that people do not divulge they have cancers. I have noticed it not more than twice or four times, that, they have told me they were under chemotherapy or radiotherapy. Such sensitive information, they might not give it to everybody. If we are empathetic, definitely they will divulge a lot of information about themselves. Whenever a patient walks in to an ophthalmic setup or any hospital per se, they come across various people, various staff. They just don't meet the doctor directly. Probably, it starts off with parking. Then they have the reception area. Every place, every other individual, empathy can be practiced. Of course, in parking, if they have some issues with parking, being in a metropolitan city or even a two-tier city, parking is a major issue nowadays. People can have issues and they come up, they're already grumpy. Reception, they have other issues. Then, they're unhappy about the whole situation. Whereas even a receptionist, even if they greet them, be, nice to them, probably, they are, better off. You have the waiting area. After that, they meet the optometrist. I'm just going to, concentrate just on an ophthalmic setup where they meet the optometrist, where they give their complaints, they check their vision, glasses, they meet the physician. Probably that is where they spend a little more time. When the physician, helps them with their whatever, the decision making or a cataract surgery or whatever, for me, it could be a collagen cross-linking or whatever we counsel them with. They finally meet the counselor. There are various touch points where empathy can be taught to your juniors or your colleagues so that, the patient has a pleasant experience. This is showing a scale where a balance where, the onus is greatly on the physician, followed by the optometrist, counselor, and reception. Various places where empathy can be emphasized so we have a better understanding of our patients and we build a long-lasting relationship with them. How can we improve our level of empathy? We have challenges. We have to consider any preconceived notions, or we have to challenge our own biases based on the cultural differences or based on their ethnicity or the cultural practices. Or you always have to consider the other person's point of view. This is how we can improve our level of empathy, by just understanding various things. How do we go about assessing empathy? There's a small psychometric analysis which was done in Thomas Jefferson University in Australia, where they tried to give the psychometric analysis to the residents. And even, they also, they broadened this thing even with the practicing physicians. How do we assess it? It's not an empirical data. It's just a psychometric analysis. It's just a framework of measuring empathy, which can be, you can download this form and you can use it even in your setup. It has a set of, this is how the JSC survey or the Jefferson's empathy scale survey looks. It has a few questions and there's a grading manner, which is given a gradation from 0 to 7. There are a few questions based on the care provider, what they feel for the patient, and various things which they touch upon a lot of things, emotional issues, emotion based from the patient or your own emotional issues. The grading is given from 1 to 7. 7 is the highest and 1 is the least. Can be summated, and we can look at various points, can be filled in by all the people in your institute. So you can just analyze what is the level of empathy that we are emphasizing, we are practicing in our particular institutes. There are a lot of ways of improving our empathy. There's one way of doing, a few I've enumerated, is reading literary fiction. Reading literary fiction, how does it help? Basically you role play the characters. This way you can improve your level of empathy. There are various other levels. It's just that I've enumerated one of them. This is how I've gone about, dealing with how, when, and what of empathy. Probably, if there are any questions, we will take it at the end of the thing. At the end, I would like to end my talk by quoting Dalai Lama. If you want to be happy, practice compassion and empathy. If you want others to be happy, practice compassion and empathy. Thank you. This is from Team Zamindas. I am very proud to be a part of this team.
Thank you so much, Dr. Soumya, for this wonderful talk on empathy. Yes, I completely agree with what you had to say. We all have met many sick unhappy patients in our life, and empathy could have made the difference. So thank you so much. We will, of course, have questions for you at the end, so please stay with us. Over to Dr. Katyayani. Dr. Katyayani is our medical superintendent and a senior comprehensive ophthalmologist. She is going to talk on a very important subject about communication today, that is communication in challenging situation. What do you need to do in challenging situation? How does the communication change in challenging situations? So over to you, Dr. Katyayani. The floor is open for you.
Good afternoon, ma'am. Good evening, everyone. I'll just take a moment to share the screen, ma'am.
Surely, of course. Meanwhile, if you do have any questions, suggestions, or ideas, we have a topic in the panel discussion, innovation in communication. We will be definitely happy to read some innovations which you have had in communication in your hospital during the COVID era. Please do write to us in the chat and we'll bring it up in the expert panel discussion. Thank you so much. Stay with us till the end. We have Dr. Ilan Kumran and Dr. Anurag for the panel discussion later.
Can you see my screen, ma'am?
Yes, Dr. Katyayani, very much.
Am I audible?
You are very much.
Okay. Good evening, everyone. I'm Dr. Katyayani. Today, my topic is enhanced communication in challenging situations in an eye hospital. Challenging situations in an eye hospital arise when there is a mismatch between the perception, expectation, and communication between the patient and the doctor.
Dr. Katyayani, should we ask Dr. Nazia to start till the time you sort out your challenge? Oh, no, you're good. Yeah, we are good, yes.
What are special or challenging situations? These are situations in any eye hospital or any hospital which arise when there is a mismatch between the perception, expectation, and or communication between the patient and the doctor. And this could be caused by the doctor, the patient, or both. What are the factors that cause these challenging situations? These factors that contribute could be related to the doctor, the patient, or the hospital. And the impact of these challenging situations is on the doctor, the patient, and the healthcare system. Now, let us look at how to handle some of these difficult situations. Plan your interaction well in advance. Write your points. So, before you speak to the patient, when you write down your points, this will help organize, filter, and refine your thoughts to communicate better. Use simple, plain language that is clear and non-threatening. Use words appropriately that will not offend or be perceived negatively. Base your language on the questions put to you and the cognitive ability of the patient you're speaking with. Be alert and watch out for warning signs. Warning signs like raised voices, uncharacteristic silence, sarcastic remarks. Some could even express negative body language like staring, invading personal space, some postures like clenched fist, jutting chin, or puffed out chest. Some patients even exhibit threatening gestures like finger pointing, foot stamping, pacing back and forth. And some may even go to the next level of aggressive behavior like kicking furniture and hitting themselves. While in a difficult situation, while in such a negative situation, focus on highlighting solutions when there are disagreements. And involve the caretaker in the conversation when, especially if it involves bad news or the information being perceived or received is negative, unexpected, and or difficult to understand. If the patient attendant is unavailable, check when they can be available for discussion. If there is something important you want to talk to them about and you feel the time doesn't seem right, then fire a warning shot. Tell them that you want to talk to them about something important. Tell them that I know you're busy, but could we probably catch up in 15 minutes time? And remember, the appropriate environment is important. Approaching a patient in a busy, high stimulus area with a lot of people can hinder your communication. If you're going to ask questions of a personal nature, environment is of particular importance. Also consider taking consent if many people are going to be present during the discussion. Example, students are going to be present. Avoid phone calls during discussion. While modern technology has brought with it benefits of instant connection, it can also be a distraction. Ideally, when engaging with a patient, you should not be taking any phone calls. If, however, you need to, and it is a good idea that out of respect to the patient, to let them know in the beginning of the interaction itself that you may need to take an urgent call and apologize for it in advance if it is to happen. Listen to the patient for full understanding of his perspective. Allow them the opportunity to give you a picture of what they're trying to say. Positive body language and non-verbal communication. Put the patient at ease while using non-verbal cues that show interest and concern. Show positive and open body language, such as appropriate smiling, nodding, and eye contact. Get the eye contact right. Too prolonged can be perceived as staring. Respect personal space. Standing too close could be seen as a threatening act. Let us now look at how we can enhance our communication skills. Use pictures and models to explain a patient his condition. Involve the entire team in patient education. Example, if the patient has to be explained about glaucoma medicines, these can be done by the reception staff. Avoid information overload. Give them written information to supplement or reinforce spoken word. Share some important websites or links to get further information about the patient's condition. Ask open-ended questions. Use what, why, when, and where, and how. And summarize at the end. Remember, there's always scope for improvement. Reflect and self-assess yourself. Improve your skill. Remember, feedback from the patients and peers is invaluable. Observe seniors and colleagues. Building rapport with the patient is very important. During this, you do not have only one chance. Not every situation has to be perfect. Communication evolves. Be realistic with your expectations and be patient, yet motivated to create small changes. Take help from colleagues and discuss with seniors. Take up a training if it is required. Do not react and start disagreeing with patients. While handling a difficult situation, remember it's human to have feelings and emotions. Do not lose your temper, raise your voice, get angry, sarcastic, provocative, or attempt to humiliate the aggressor. Say no to unreasonable demands, but at the same time be prepared to face any adverse events. Show warmth and empathy and have a professional attitude. Do not let a bad experience with one person affect your family life or your entire day. Keeping a perspective will help you go through this easily. Let us now look at some situations where communication is vital. Communicating with patients with disabilities. While communicating with patients with disabilities, talk in the same way and with a normal tone of voice as you would talk to anyone else. Talk directly to the patient rather than to the accompanying person. Keep in mind their disability and their personal space. Do not push or move a person's wheelchair or grab a person's arm to help them without asking first. When speaking to someone in a wheelchair, sit down so both of you are at the same eye level. While talking to patients with hearing impairment, ask the patient how he prefers to communicate and eliminate background noise and distractions. If the patient is using a hearing aid, make sure it is on while talking to him. If speaking through a sign language interpreter, pause occasionally to allow the interpreter time to translate. Talk in a normal tone without shouting. Then ask them to repeat what you said to understand what they've made, to assess their understanding. While communicating with elderly patients, avoid an overly familiar manner while talking to them in the first meeting. Ask before addressing them how they would prefer to be called. Avoid complex medical terms. Be prepared to repeat yourself multiple times and explain concept in different ways so they understand your point of view. If the caregiver is present, remember not to ignore the patient and keep the patient in the conversation. Always keep them in loop of the conversation. Though the patient may not understand a lot, it is important to show them respect and dignity and offer them the extra time while communicating with them. While communicating with children, explain the procedure to the child, and this will help reduce a lot of anxiety. Trying to explain a difficult concept to a very young person in terms they understand, and at the same time including the parents, is definitely challenging. So use simple language. Tailor your speech to meet their needs. Avoid negative words like hurt or sting. Offer lots of reassurance and also a small reward for their resilience, bravery, and cooperation. Use positive, non-threatening voice and to show them that you mean no harm. Show positive body language that you're listening to them. Now let us see how to handle situations while speaking to different language speaking patients. Learn some polite expressions and key phrases. Learn some key anatomical terms in the native language. Speak short, simple sentences that are easy to translate. Use pictures to explain. Example, how to instill eye drops. Take the help of a translator, and if it is a family member, ensure they are present during all the visits. Consider learning a new language too. It is fun. Remember, while breaking a bad news, this is an important challenging situation. Double check your facts before talking to the patient. Prepare yourself before you talk to the patient and prepare the patient himself and be compassionate. With this, I summarize saying that simple language has to be used. Adapt. It's not a one size fits all approach. Some patients need more time and some need to be brought back, interrupted, and brought back on the track. And have a positive body language. Remember, communication is not always with words. And teamwork. Involve the entire team in patient care and education. The patient's family member should also be included in the treatment. Stay alert and watch out for warning signs. With this, I conclude by quoting these lines by the famous Persian poet Rumi. Raise your words and not your voice. It is rain that grows flowers and not thunder.
Thank you so much, Dr. Katyani, for that lovely presentation. And yes, indeed, just like Rumi said, raise your words and not your voice. In this world where the attention span is reducing every day, we need to really remember this, that we need to be above, we need to have almost a spiritual inclination if we want to succeed in our communication. Over to our last speaker, last but not the least, and a very important topic, documentation of critical communication. NABH would say that, and of course, any medical legal case would also say that we believe only in God. Rest should show documentation. So it really helps, not just in medical legal cases, but in general day-to-day life at your eye hospital, to document critical communication. And we are very eager to hear Dr. Nazia talk to us about documentation of critical communication. Over to you, Dr. Nazia. Please do stay with us for the panel discussion.
Hello, am I audible, ma'am?
Yes, very much, Dr. Nazia.
Good afternoon, everyone. And once again, a warm welcome to everyone. I'm sure that everyone will agree with me when I say that excellence in medical documentation reflects and creates excellence in medical care. I'll be speaking more about this as my topic for today. Documentation of critical communication is only a reiteration of the same. We are all familiar with this phrase, what is not documented is not done. Documentation is an integral component of good professional practice and the delivery of quality healthcare. I want to highlight the fact that when we talk about critical communication, we are not only talking about communication between doctor and patient, we are also talking about communication between doctor and optometrist, optometrist and patient, doctor and patient coordinate, anesthetist and OT nurse, so on, so forth. I'm sure your minds are racing with the endless possibilities of person-to-person interactions which form a part of critical communication. Regardless of the form of the records, whether electronic or paper, good clinical record keeping should enable continuity of care and should enhance the communication between different healthcare professionals. These records are also valuable documents to audit the quality of healthcare services offered and can also be used for investigating serious incidents, patient complaints, and compensation cases. One must also keep in mind that these documents are part of legal records admissible in the court of law. This is one more important reason to maintain meticulous records. Like I said earlier, good record keeping is not only the job of the medical director or the doctors, but each person working in a healthcare organization has a role to play. Whenever or wherever appropriate, all members of the multidisciplinary team that are involved in patient's care and in the smooth functioning of the healthcare organization should do their valuable bit. In the interest of time, I'll not be able to give an exhaustive list of situations where documentation of critical communication plays a crucial role, but I would like to discuss some case scenarios which we all may be familiar with. Here are some of the outpatient doctor-patient communications which need to be well documented for both the sake of the doctor and the patient. For patients diagnosed with glaucoma, it's important to explain to them about the progressive nature of the disease, need for compliance to medication, and importance of regular follow-up. In case of patients with diabetes, they need to clearly understand the importance of strict glycemic control and how it is related to the progression of their diabetic retinopathy. The importance of early intervention to prevent worsening must be explained to the patient with age-related macular degeneration. The needs and expectations of patients due to undergo cataract surgery should be considered while explaining the procedure to them. The visual prognosis and complicated cases must be communicated in clear terms. And it goes without saying that documentation of each of these issues will play a vital role in ensuring that your patients are happy and that you get a good night's sleep. These are some of the examples of critical communication with the patients that we maintain at a hospital. They may seem trivial at a cursory glance, but can make a huge difference in the well-being of our patients. We have made bilingual seals stressing on the importance of continuing anti-glaucoma medications till further notice and using steroid eye drops only for the period indicated. These seals were born out of situations where we wished we had communicated to our patients better. In case of argumentative patients trying to imply it is our fault that some untoward incident happened, these can be used to transform the same patient into an apologetic one. We also make it a point to mention drug allergies on the patient file and in our software. When we started this practice, we found that so many of our older patients on subsequent visits had no drug allergies, which we were not aware of, just because we had never asked till then. Now we come to communication in the case of the patient scheduled to undergo cataract surgery. This is of vital importance in all our practices. These can be categorized into pre, intra, and post-operative. Let us start with pre-operative communication. As you can see, each of the items mentioned in the individual boxes is an important piece of information to all the members participating in the surgical process. One such example is that the patient is on medication for benign prostatic hypertrophy, and this has to be communicated to the surgeon so that he or she is prepared for a floppy iris during the surgery. These are some of the forms which we count on to ensure there are no hiccups. These may be tailor-made to each of our practices. Now, we look at the intraoperative stage. Again, there are various parameters, none of which can be overlooked. We practice a timeout before starting the case where we specify the name of the patient, eye to be operated, intraocular lens power, and plan of the surgery. There was an incident where the surgeon remembered that the IOL power mentioned during the timeout was not the same as the one mentioned when the IOL package was opened. The OT assistant usually calls out the intraocular lens power before opening it, and this is verified by the anesthetist. Now we come to the post-operative stage. Extra chair time spent in explaining each of these will go a long way in ensuring you have a happy and a satisfied patient. This is usually done at our center by our counselor. Here's a quick glance at one of our checklists and our post-op medication list with dates and timings. Let us move on to critical communication with the team. Our equipment is an important part of our arsenal. There are times when we have struggled because there is a loose contact in our straight lamp wiring or some bigger problem which our in-house maintenance person is unable to address. This is where the breakdown register comes into the picture. The person who first detects the problem notes down the same in the register. This information is conveyed at our center to our center head, who communicates with the concerned company official to handle the problem. If the said instrument is critical and has no backup, like say the HFM machine, then turnaround time has to be short so that the work doesn't suffer. Maintenance of incidents or adverse event register is important to handle mismatch in communication. For example, if staff has instilled wrong eye drop which the patient is allergic to, it leads to adverse effects. This can be prevented by root cause analysis, preventive and corrective action so that this will be avoided in future. To have a better communication with other specialty doctors, we maintain a record of patients referred. Telephonic call is made to doctor and explained regarding the patient. Referral letter is handed over to the patient. Along with this, a SMS is sent to the specialist about the diagnosis and the advice. Last but not the least is to have periodic training to the staff to educate about the communication of documentation. To conclude, palest ink is better than the strongest memory. I would like to thank entire Zamindar team for the constant support. Thank you.
Thank you, Dr. Nazia, for a wonderful presentation. And there were many of the communication sort of documentation, what we do at Zamindar's Eye Hospital, Dr. Nazia shared over here. They're simple documents, nothing which is rocket science about that, but that goes a long way in helping us ensure a good patient-doctor relationship. And now I would like for the speakers to also stay back for the panel discussion. I welcome Dr. Ilan Kumran. There's no need to introduce Dr. Ilan in Karnataka Ophthalmic Society. I can say there's no need to introduce Dr. Ilan in all India stage also. He's a very popular doctor. He happens to be my neighbor, an excellent clinician, and I thank him profusely for giving us this chance. I also welcome Dr. Anurag Mishra from Radha Raman Hospital, Cuttack, a very dynamic ophthalmologist, and I'm looking forward to all your brainstorming ideas about how can we better the communication. So, Dr. Anurag, are you there? Can we say a quick hello?
Yes, ma'am. Just in time.
Very good.
There,
just in time.
good evening.
Yeah. Good evening. So let us start with Dr. Ilan first. The first topic for panel discussion is how to build patient loyalty through better communication. Dr. Ilan, what do you think about it? Do you think the patient's loyalty can improve with better communication? And if so, what is your personal experience?
Definitely, ma'am. The patient loyalty can be, a patient becomes loyal only if he can communicate in his language and in his tone. Almost all of this has been discussed in the previous three excellent talks, all three of them. But I would like to add two things. Communication, not just by the doctor, not just by the optometrist, but it starts from the watchman, from the parking assistant. There are so many of them who land up inside the consultation rooms with a grim face because something has happened in the parking area. And they think that it is the doctor who is responsible. So it starts from there. And if a patient has to continue, excellent surgery, excellent treatment, all these come later, but it is how we communicate to this patient what we are going to do. And for this, there's one thing that I was taught when I joined Columbia Asia. Talk to the patient in his or her own language. However little you might know. We might know just one word. But to a person coming from Arab, shukran, that's a word I learned first. Or to a person coming from any part of a country, one or two words and then say, I don't know, I can understand a little bit, probably use an interpreter instead of just talking in our own language. This is very, very important. And communication is, answering your question, communication is the most important thing if you have to buy a patient's loyalty.
Absolutely. Thank you so much, Dr. Ilan. Over to Dr. Anurag with the same question. What do you think, is patient loyalty related to effective communication?
I absolutely agree with whatever Dr. Ilan has said. And I keep on saying this, reiterating this in our team meetings also, that communication with the patients should be 30% spontaneity, 50% linguist, 80% honesty, and 100% compassion. Why I've kept the linguism and the spontaneity at 30 and 50 respectively is because a lot of people tend to think that that's in your genes. If you are spontaneous, you are spontaneous. If you are a true linguist, you are a true linguist. So you don't have to be a linguist or spontaneous to effect a proper communication. Honesty at 80, because say you have an 83-year-old lady who walks into your chamber with multiple complications or complicated scenarios in the eye, you formulate the chart how to plan the surgery inside the operation theater. Not all of that needs to be told to the patient, including a conversion, a possible conversion to SICS midway. But you show your compassion by doing it on the operation theater. So honesty can remain at 80. You might not reveal the whole truth, whatever you're planning, because all of them might not be understood by them. The end point is, since you have a mixture of all these four aspects and you have delivered it to the patient, the loyalty comes because of the ultimate mixture. It is much more than your surgical skills, because let's conclude and accept the fact that everybody around is good at his or her work. Where it actually creates the difference is the wholesome experience the patient bags from your center. And how you can quickly ref check how effective you are in communicating with your patients is and how loyal they are to you is by the string that follows the patient you have primarily treated. His family, her family, their relatives, their friends. And if you know that they have been instrumental in bringing them to you, if you can run that ref check from time to time, you would know exactly how much of loyalty are you earning, and thereby maybe take resurrective measures should they be required.
Thank you, Dr. Anurag. Thank you so much. What I would like to add over here is that if you're seeing a patient for the first time and the patient had to wait a little extra before the patient enters your room for whatever reason, the first thing you need to apologize and say, I think you had to wait a little extra and I'm sorry. Acknowledge that the patient has waited extra. In case if you had to postpone the appointment, that has to be told to the patient, the specific reason why you had to postpone the appointment, and very clearly and in a very apologetic manner. the explanation that why a patient needs to wait so much in an eye hospital. There is dilatation, there are so many machines, and so why so much time takes, for eventually the patient to leave the hospital should be very, very clear and crisp, and the patient should understand that. So this, even before the patient reaches your room, the patient can be disturbed, like what Dr. Ellen says, and you need to start with a sorry whenever you feel that that is required. So I want to remind Dr. Nazia, Dr. Katyayani, and Dr. Soumya that if there are any points which you feel you'd like to add, please unmute yourself and go ahead while we continue with this discussion. The next part of the expert panel discussion was innovation in communication. Is there a new way in which you have started communicating the patient, maybe in the COVID era or even otherwise? Dr. Ellen, over to you.
Whether we could innovate or not, COVID made us innovate. I think Dr. Soumya put it forward, only 30% is verbal, whatever we communicate about the patient. And she also put it very clearly, it's the first 2 minutes. I don't know whether you said it or she said it. First 2 minutes is very important. But in COVID, it is the first 15 minutes we make the patient, and we ourselves go through a lot of torture before even coming face to face with the patient. Yes, a lot of innovations are required. Innovations, most often, what we don't do in a busy practice, when we are seeing 70 patients, we just keep talking to them. Sometimes just getting up, going close to the patient or touching the patient helps in a lot of way conveying our feelings. Like you said, sorry, as soon as the same sorry can be just a touch, and then it can be conveyed. Second, most of our face is covered nowadays. So it's the eyes that have to speak. Yes, at the end of the day, most of us are tired, looks red, we want to go home, but a patient has come with a problem. Let's probably show a smile there and then do it. Other than this, innovation in communication, I'm not able to think of much.
Okay, thank you.
Others I'd like to hear.
Yeah, we would like to hear from Dr. Anurag, and anybody else has any ideas?
Strictly speaking, I don't know whether it's an innovation or not, whether this comes under the purview of innovation. This is definitely not breakthrough. But what we have done at our center is we always acknowledge and appreciate and say a thanks for the very fact that the patient has initiated a communication with us. For example, if a patient makes a phone call to any of the hospital numbers, we have around 10 numbers running in. Any of the hospital numbers is an automatically generated SMS that goes to the patient within seconds. Thanks for reaching out to us. And we would love to be of assistance to you in the future. And when we make a phone call to the patient, the same SMS goes, but with just a different language, that thanks for receiving our call. So we always appreciate that they are affording time, dedicating time to talk to us, be it them who has initiated this or be it us. So that's one thing that's we have done. The other thing that I have done personally is that I have drawn a lot of pictorial schemas trying to explain difficult situations like how the optical pathway runs. I've tried to simplify it as much as possible with telegraphic drawings. I've done that myself. Designed that myself, and my social networking guys, vendors do it. So say, for example, somebody has a multifocal implant in one eye and the other eye is yet to be operated. We explain why it needs to be taken up early with the help of those pictures. So it just adds to the value of your explanation if things go visual. So we try to make it as much visual as possible, particularly if we are experiencing an atypical situation. Again, definitely not breakthrough. That's just the way I thought would augment what was already existing.
But Dr. Anurag, that was lovely. I've not heard about this before. So it definitely is an innovation. And we'll be very happy if you share with the Karnataka Ophthalmic Society. I'm sure Dr. Ellen will share with all of us, if you can share with him. And we'll be very grateful. We'll bless you so that you do very well in Radha Raman Hospital. Thank you, Doctor. That brings us to our third discussion about communication, is that as a leader, what are your personal things? How do you need to change to set the communication right in your hospital? Anyone of you can take it first.
No, it has to be Dr. Elan first.
we should remember one thing. In a hospital, even our staffs are coming with a lot of problems. It is like in a department in a medical college. Let's say in one of the units, if the professor had a bad mood, that translates into, I mean, it is shifted onto the senior residents, then junior residents, and finally the patients bear the brunt. This is what happens in a hospital also, be it with 5 staff or with 20 staff or 200 staff also. There should be a method which we have to teach, like what you have did excellent sessions, Dr. Samina ma'am, in your hospital. Many of us have learned it from you, how to teach. Number one is to teach the staff how to behave with the patients, irrespective of what mood they are in. Number two, definitely all of us lose a cool sometimes, but there should always be 2 or 3 people. When one loses the cool, at least the other person takes care of it, so that it's not passed on, whatever that irritation is not passed on to the patients when they are attending to those patients. These are 2-3 things which we have to be very careful. Dr. Anurag made a very important point. Always, let's be honest. And you made a very important point. It's not definitely not wrong to say sorry to anyone, because that word sorry immediately cools down this patient. Patient, or for that matter, anyone, the word sorry. So these are 2 things, if we practice even with our staff, I think they will also do it with the patients also. This is what I feel. Dr. Anurag?
Yes, sir, absolutely agree. I think when it comes to communicating with your staff, I very strongly believe that this is where, as one of the talks also encompassed, it has to be strictly nonverbal, as less verbal communication as possible with your staff. I always cite an example to my staff about being in a restaurant which used to serve thali, and it had almost 30 dishes on the platter. And everybody who served the dishes in the restaurant were talking to each other in sign languages, 1, 2, or 3, no verbal communication at all. So I tell them, whether you're in the OPD or in the OT, when you're talking amongst yourselves, you should use sign languages as much as possible. And that is possible only if you understand each other well. So it's a family, you all are members, you have to have that wavelength match and that bandwidth match. That is something you have to teach them as the leader. The other thing that I always keep telling them is that there are a few areas which are absolutely non-negotiable. One of them, for example, is the in time to the hospital. You look at the time you come in, you do not look at the time when you go out. And when somebody is late, you as the leader has to be punctual at the first instance. If it's 9 o'clock, it has to be 9 o'clock for you, or 8:55. If you are on time, your staff would be on time. So you are the leader, they would be following. And if somebody comes late, do not tell him or her anything. One glance at the staff and one glance up at the clock will explain everything to the staff. The next time, it will not be repeated. The third thing I tell them is, when you are trying to communicate with the patient, you have to remember that it is always the slow fat that simmers and cooks the perfect rice pudding or kheer. So if you want to have the sweetness of the kheer and the taste of the kheer intact, give it time. So you as the leader cannot expect to finish off 10 patients or dispose of 10 patients in 20 seconds, and yet expect your staff to give 15 minutes per patient. So you have to give time to them first and ask them to be the simmering fat that cooks the perfect kheer. So you have to lead by example there also. You cannot blame the number or the volume you're handling for not giving time to the patients. Because if you're not giving time to the patients, you will never ever have the volume to handle. It's always counterproductive. So either positive or in the negative way. So you have to have the qualities that are absolutely essential and you want to implement in your hospital, and only then can you ask your staff to follow you and follow your instructions.
That's so amazing to listen to you, Dr. Anurag. I think it's not very soon we'll be hearing you in a TED talk about communication. You're speaking so well. Thank you so much. Dr. Ilan, the last point over here for communication is that if there are any tips which you can give, maybe there are some young ophthalmologists who are starting their practice now and who would like to learn from you. What are the few things you've learned over years? Some tips in communication. Please do share.
When I look back at my life in the practice, the best time, probably the best communication, the more time I spent with the patient, the more honest I was when I was a resident and probably in my early practice when I used to see a few patients. Somewhere in between, we lost that. And somewhere at that time, someone else had to teach us, and then we are trying to inculcate it now. So only tip what I give them is that residency period, post-residency period, whatever you are doing, that's why the practice was built up. Whatever you are doing, please continue it. Just running behind something else and then losing this communication part, it will definitely not help. Yes, that said and done, with each and every step, we pick up one or the other skill. Just like that in communication, we will pick up one thing or the other from our peers and friends. Do that. That is more than enough. And of course, Dr. Anurag put it very well. If there's one important thing in communication, it's timely giving the information as well as the reports. He was suggesting SMS. Now we have, I think SMS or email. That's what he was suggesting. We have WhatsApp also. These people are very good with it. And proper display at different places so that they know before they come into the chamber. This is one thing I would like to add.
Thank you, Dr. Ilan. Such pearls of wisdom. Thank you so much. Dr. Anurag, what are your parting lines before we put an end to the session?
Well, the young Turks of our fraternity need to understand that at times I have seen them being a little disappointed or a little frustrated with how things go in life. I think what causes this is too much of expectation. And just like we ask our patients not to expect too much from too little, it also applies for you. I mean, if you are working for 12 hours a day, if there's no one to listen to your problems and just keep burdening you with theirs, such as patients, you to have nobody to blame because you are the one who had signed up for this. You are the one who got into medical science. You are the one who chose to be an ophthalmologist. So whatever be your issues in life, if at 7 o'clock in the evening, after you having been robbed of all of your energy for the past 12 hours, if you look at a patient, you see a patient, he is not supposed to understand your problems because he has come with one of his. So you show that compassion to him at 7 o'clock in the evening after working for 12 hours. Believe me, it's going to come back to you fivefold sometime in the future, paying you rich dividends. So never ever give up. This is one of the best professions you've been in. This is one of the best branches of science you're practicing. Keep on, keep rolling, and keep rocking. Thank you.
Awesome, awesome. Very, very nice. So I so much agree with you, Dr. Anurag, that you cannot pour from an empty cup. Take very good care of yourself. And I would like to thank Dr. Ilan for this opportunity. Thank Dr. Anurag for agreeing. I know he was so busy with the Varanasi conference and in between he has come to us. Dr. Ilan, the conference is going on so very well. So thank you so much for that. And thank you so much to my team, Dr. Katyani, Dr. Soumya, and Dr. Nazia. Thank you so much. God bless. Good luck.
Thank you.
Thank you so much, ma'am. Good night. Thank you. Bye-bye.